Today I'm going to talk about a very unfortunate but thankfully quite rare congenital abnormality that affects fetuses. There are a vast amount of symptoms and potential problems that these poor children will face. It can often be detected on ultrasound during the pregnancy, allowing the parents vital time to prepare to support and care for a baby with a host of medical needs. Caudal regression syndrome is a rare congenital abnormality in which a segment of the spine and spinal cord fails to develop. It can affect many parts of the lower body. This includes the caudal spine and the caudal spinal cord, the hindgut, urogenital system, and lower limbs. This is a relatively rare disorder in the general population. It affects 1 in every 10,000 babies born in the general population. However, there is a certain maternal disease that I will talk about next that considerably increases the likelihood of a baby having this abnormality. 1 in 350 babies of this group will be seen with caudal regression syndrome. The main risk factor for a baby being born with caudal regression syndrome is if the mother has diabetes. As I explained a moment ago, the risk increases considerably when the mother presents with diabetes. The baby becomes 250 times more likely to have caudal regression syndrome when they are born to a mother with diabetes. The causes of caudal regression syndrome are still being researched in the general population. There is a genetic component to caudal regression syndrome. Many researchers believe that a main cause of caudal regression syndrome is disruption of the canalization process during the 3rd week of gestation. This simply means that there is some sort of environmental or genetic occurrence that causes this syndrome to develop in the 3rd week. As stated on the previous slide, the abnormality begins as early as the 3rd week of development. Therefore, this disorder can begin to be detected very early in the pregnancy. The earliest sign that caudal regression syndrome may be affecting the fetus is a fetus with a short crown rump length and an abnormal yolk sac. There are many different expressions of caudal regression syndrome. Some cases are much more mild, while others are more severe. Presentations of this abnormality include small hip bones, underdeveloped femurs, legs may be bent out with the knees pointing to the side, and club feet. Some patients also present with scoliosis, and as previously mentioned, they may be missing segments of their spine. There may also be problems with the organs in these children. They often present with genitourinary abnormalities such as a missing kidney, fused together horseshoe kidneys, or ureteral duplication. There may also be problems with the large intestines and other malformations of the gastrointestinal tract. Because of kidney abnormalities, patients with this congenital abnormality often get UTI infections and kidney failure. There's often damage to nerves that are in charge of bladder function, which leads to the patient being unable to control their bladders. This condition, called neurogenic bladder, leads to a host of other problems such as infections, stones, and UTIs. As you can see, caudal regression syndrome is a complicated syndrome. It has so many different effects on the lower half of the body. Because of this, the symptoms are very variable. It is difficult to know how affected a baby will be. The baby might suffer from mild to severe scoliosis and have abnormally shaped vertebrae. The child may have frog legs position, as seen in this image. In some severe cases, the child will not be able to walk and will have to use a wheelchair. Some children may be able to walk, but because of the knees pointing outward or the feet turned inward, walking will be affected. And some babies will present with hernias or twisting of the large intestines. Others will be affected by congenital heart conditions, and depending on the severity of the disease, some children will have a very poor and painful quality of life, while others may be able to enjoy fairly normal living conditions. As with everything else in caudal regression syndrome, treatment options will vary drastically depending on the symptoms of the disease. Because many children with this syndrome have difficulty going to the bathroom, they may require insertion of a catheter and possibly even a colostomy. Some patients present with urinary tract or bowel blockages because of this disorder. This requires surgical intervention to fix. Prosthetics and assisted mobility devices can help children move around on their own as they get older, improving their quality of life. Surgery may be needed to help repair the skeletal system and possibly replace body parts that did not develop in utero. Many children with caudal regression syndrome need multiple surgeries as they grow and develop. Unfortunately, there is no cure for caudal regression syndrome. It is a lifelong condition that often requires a lot of medical attention. Medication, assistive devices, and surgery are in the future for children presenting with this syndrome. However, thanks to modern medicine, these children often go on to live healthy lives. In the most severe forms, their quality of life is poor. However, with the range of treatment options, a large portion of these children do quite well. If the child is suffering from a severe form of caudal regression syndrome, they die within the first month of birth due to cardiac, renal, and respiratory complications. In moderate forms, they may spend a few weeks in the hospital and undergo surgeries to fix urinary tract anomalies and intestinal problems. In more mild forms, the child will still likely undergo multiple surgeries and need some assistive devices, but can live long, relatively healthy lives.